Today on Healthline, waging war against HIV/AIDS in Fulton County. As the county's health department is coming off of a record-setting year of HIV testing, there's still more to be done. We have the CDC's Associate Director for Health Equity, Division of HIV/AIDS Prevention, right here in the studio with us. We'll get the latest on what the CDC is doing to address HIV-related health disparities. I'm Lynn Vaughn. We'll have that and more on this edition of Healthline. Stay with us. Hi, welcome to this edition of Healthline. I'm your host, Lynn Vaughn. Today we're talking about a health issue that challenges more than 1 million people in the United States, with thousands right here in Fulton County. We're talking about the number of people who live with HIV. Fulton County is tackling this issue head on. In fact, the Board of Commissioners, by resolution, has established the Fulton County Task Force on HIV/AIDS. And the sole mission of those community leaders and stakeholders is to decrease the transmission of HIV within Fulton County and to improve the quality of life for persons living with HIV infection. Now, here with me today is Dr. Donna Hubbard McCree. She is the Associate Director for the Health Equity Division of HIV/AIDS Prevention for the Centers for Disease Control and Prevention. Kind of a long title there. Welcome to the show, Dr. McCree. Thank you so much for being with us.
Oh, thank you so much for having me.
Well, we have lots of ground to cover, but first, let's give our viewers a little glimpse into your background.
Okay, so I am excited about being here again in this conversation. This is probably about my 35th year of doing public health work in HIV. I'm a pharmacist by undergraduate training, but my doctoral level training is more around designing behavioral interventions for individuals who might be at risk for sexually transmitted infections, including HIV, with a focus on disparities, and that is addressing those issues where one population or the other is more disproportionately affected than another. I want to find out why, identify those causes, and then identify ways that we can intervene to have an impact. Most of my work has been either with women, I've done a lot of work with women, but also with gay and bisexual men who are disproportionately affected. African Americans, any racial ethnic populations that may be more affected.
Well, where does that passion about this issue come from?
You know, it started back in 1979 when I was a pharmacy student, which is interesting. There was a next door neighbor of mine who had been diagnosed with genital warts, and I could hear her parents talking to her about it and how they were treating her, and I didn't understand why, as a health professional or a future health professional, I didn't know what that was. And then so I inquired about it, didn't get much of a response from my professors. It was more of a, you just need to treat your patients and send them out. And I thought, well, that's not the kind of professional I'm going to be.
Right.
So I started learning about it in 1979. That was human papillomavirus and genital warts. And then when I was a practicing pharmacist, something started killing gay men in San Francisco, and we didn't quite know what it was.
I remember the era quite well.
Oh, yeah. So my passion kind of shifted a little bit, and I thought, wow, this is something that we need to get a handle on, and I started to follow since then as a practicing pharmacist. Then made a whole career change, went back, did an MPH and a PhD, and a postdoc with women living with HIV. And that started me on this odyssey. And I've been doing this now for almost 17 years at CDC.
Awesome, awesome. Yeah. Well, tell us about the national status of HIV. We have come a long way since those early 80s when people were literally dying from the virus. But where are we now nationally?
Well, you spoke in the beginning about a statistic. We estimate that there are about 1.1 million people living with HIV. And about 1 in 7 people are unaware of their status.
Wow.
Now, that is an issue. We have made some significant progress since the beginning. Even looking at, let's say, 2008 to 2014, we've seen an 18% decrease in new infections. And we've seen successes in persons who are at risk due to heterosexual contact, 36%, 56% among persons who inject drugs, even among gay and bisexual men. But only stable among black, gay, and bisexual men, and we've seen increasing rates among Hispanic, Latino, MSM. young black men who have sex with men. Very concerned about those rising rates in those two populations. When we look at what's going on by gender, we do also see some significant disparities there. African American women made up 64% of our new diagnoses in 2015. And then still African American communities are more disproportionately affected than others, and Hispanic Latino communities as well. So while we've made progress, and we have made progress, 42% declines among women, there's still a lot of work that still needs to be done.
And people can now live with
yes.
HIV because there's treatment.
Of course.
And of course, back in the day, there wasn't. Do you know why the rates that are in the groups that are increasing, where it's increasing, like young people and then African American women? Do we have an understanding of why that's happening?
Yes, we do. When you think about it, it's particularly, let's say, African American communities, we have more people living with HIV in our communities.
Yes.
So your chances of encountering someone who's infected is higher, even with less risky behavior. Not about the risk behavior, I want to put that out there. Also, care and treatment. You said something very interesting in that we do have treatments now. We do. We have an arsenal of weapons to prevent HIV as well. But when we look at things like knowledge of status, linkage and retention and care, and having the virus under control in your body, we see the rates are lower in African American communities. And that's an issue. That's why it's important that people know their status,
yes.
that they get in care, they stay in care, they get the virus under control. Things like poverty that may affect ability to access care, or stigma is still a big issue even now when we think about it. That's why these types of conversations are so important, to think about awareness and making sure there's no face to HIV.
No.
It's everyone when you think about it. Discrimination, racism, homophobia, all those things can keep people from being tested and even finding out their status. So those are some of the reasons that we're looking at when we talk about the disparities.
And so is that why we want everyone to be tested?
Oh,
because
yes.
if you make it global, then people don't feel singled out if they do happen to be in one of those groups. Is that right?
Of course. Oh, yes. And the recommendation is that everyone between the ages of 13 and 64 be tested for HIV at least once.
At least once.
It's a part of your routine care. And if you might be engaging in behavior that puts you more at risk, then more frequent testing, perhaps once a year. And then gay and bisexual men, sometimes other men who have sex with men, may need to test more frequently, every 3 to 6 months, let's say. But yes, just like you get your cholesterol checked, your blood pressure checked,
absolutely,
get an HIV test.
Absolutely.
Yeah, so you know your status. Yeah, that's critical.
Tell us a little bit about what's going on here in Fulton County. Why is there such a problem with HIV/AIDS in this part of the country?
Well, you know, I speak more global, more nationally. Yeah, because our data are more national data. I can speak about the South because what I can say is that, you know, the rates are higher in the South. Disproportionately higher when you think about the population size here. And some of the things that I just mentioned previously that put persons at risk, we see the South sometimes lags behind in some of those care and treatment types of
areas,
things.
in education, in poverty, we're ahead, and so yes.
So those are some of the reasons that we can see things that we talk about geographic disparities and looking at the South.
Well, our viewers really do have an understanding. I'm going to boast for a minute. Our viewers have an understanding of the social determinants of health, and more importantly, our policymakers here in Fulton County, because we began to address that several years ago. So what is the key thing besides testing? We can talk about testing too, but what's the key thing to help people get a grip on that and to really put a tamp down the rising rates among these groups?
Testing's key. That's the gateway, you know, because you cannot benefit from treatment unless you know your status. If you know your status, you have your virus under control, you can reduce transmission to others. That's key. Awareness, what you're doing today, you'd be surprised how many people still don't know their risk. They still don't understand that. So making sure people are aware, and then having access to prevention education and risk reduction methods, all of those things are critical, I would say, as well. And those are the things that we're focusing on, making sure people have knowledge of status. We're trying to prevent new infections through educating and what you're doing, talking about here. We're also trying to prevent transmission. There are other things like maybe pre-exposure prophylaxis.
Yes, and we have that here in our Fulton County Board of Health clinics. Yes,
Right.
we're proud to say.
And that's, for viewers who may not be aware, that's giving medicine that's used to treat HIV to persons who are at high risk of HIV so you can prevent transmission. So things like that and other behavioral interventions. And then also we're trying to reduce those disparities, working on the things that I just talked about, you know, to try to narrow the gap there. And doing surveillance. You know, some interventional type surveillance so we can identify hot spots when they're occurring and address them as they're occurring. Those are the kind of things that'll make a difference.
All right. Well, we'll take a break now. When we come back, we'll talk about what the CDC is doing to address HIV-related health disparities. And later, we'll take a look at the strategy to end AIDS in Fulton County. We'll be back in a moment. And welcome back to Healthline. We've been talking about the waging of war against HIV/AIDS with the CDC's Dr. Donna Hubbard McCree. Dr. McCree, what's the CDC doing to address this issue?
Well, we have what we call our high impact prevention approach. That's helping us to achieve the national goals and our strategic plan goals around addressing HIV. And what that means simply is getting the right combination of effective interventions to the right populations and the right geographical areas so we have a positive outcome. Things like I talked about testing already, also prevention tools, behavioral interventions, as well as we talked about PrEP a little bit, pre-exposure prophylaxis.
Let's expand on that a little bit more.
So, and those would be interventions that would help individuals to maybe reduce their risk behavior so you understand what they are, identify why you're engaging in it, and how do we help you to reduce it. It could be interventions that are around, let's say, for example, people who might be at risk due to injection drug use, syringe services programs, those types of things. And a big thing, too, is our sort of campaigns, our communication campaigns. We have those that are designed to get people into testing, but we also have those that are designed to address things like stigma. Let's Stop HIV Together, which says that there's no faces to HIV. There's all of us. You know, their mothers, their fathers, their sisters, their brothers. So understanding what that really means and addressing it. And that, you know, we have other campaigns that target providers. So providers are able to interact with patients. You need to have a cultural kind of competency. So no matter what the patient brings in, you're able to meet them where they are and you can address those types of concerns. So those are some of the things that our arsenal of weapons in terms of prevention. Yeah.
So what can we do in our communities? How do we help the community to understand that we all need to be in on this?
Yeah. You know, conversations like these are so important. And I think that's what we need to do in our communities. We've got to build safe places where we can talk about HIV. And it's about knowing about what is it. There are still people who don't know. How do you get it? How do you prevent it? How is it transmitted? Safe places in social media, in our homes, in our churches, wherever we live, work, and play, we need to be able to do that. Partnerships. We provide information and materials to individuals who are interested in doing, you know, outreach activities as well. We have a CDC Get Tested website where individuals can type in a zip code and find out the best places to get that. But in terms of communities, it's about keeping that conversation on the table. It's going to take all of us.
One of the really clever ideas I thought the CDC had, and I believe it comes from the CDC, is the barber beauty shop. And the business to
Bird Alerter.
Yes, thank you. I was drawing a blank there, but yes, tell us about that. I think that is a really great idea.
And that's really sort of, we have partnership opportunities. You mentioned one. We do have partnership to address AIDS, which is our PAC partners, where we sort of collaborate with 11, I believe is that number, key community organizations that are in the communities that are disproportionately affected to actually do the work around prevention prevention. And you mentioned the business response to HIV. That's what we're talking about in terms of getting businesses aware and doing sort of outreach in barbershops and beauty salons where people go to get the information about HIV out there. Those are some key things that can be done as well.
At one of our meetings, we had one of our beauty shop owners talk about how she hadn't really thought about it. She was the mother of teenagers, and she saw the impact it was having to have information in the beauty shop about it, and also to have condoms available for people who, and I know that's controversial for some people, but better safe than sorry, right?
Yes. Oh, definitely. I mean, and you make a good point there. Bringing prevention to where people really are.
Yes.
And the most effective tools should be used. And you mentioned condoms, of course. Yes, that's one of the tools that we can use to prevent HIV. So yes, and getting them in areas where people feel comfortable and where the message can be given, I think is very critical. So communities play a very key role in our prevention efforts.
And the other thing that I wanted to ask you about, getting back to stigma, I recall the time when we wouldn't hug or touch a person who was known to have HIV.
Right.
We're so far away from that, but we still haven't gotten away from branding people and thinking it's contagious and all of that sort of thing. Can the messaging that you provide help with that?
Oh, yes, definitely. We have messages that will give you an opportunity to understand how it's transmitted, and that has nothing to do with hugging an individual and being aware of that. But also, I think, as I said, and I keep talking about conversations, I think that's how you bring individuals into the fold, and is to have a conversation about it. And I think for me, one of the things that really helped me along my journey was getting to know someone who is living with HIV. What is that walk like?
And
what does that mean?
What did that do? I mean, what information did you get from that relationship?
Well, you know, for me, it was doing my postdoctoral training, you know, and I went out and I worked actually at an infectious disease clinic, and I'm thinking, I've got all of this scientific knowledge here. But then I'm walking with these women who every day lived with living with HIV and all the challenges that they had and the successes that they had. And what I realized is that to do the work I needed to do, I needed to fit my work into their lives, not their lives
not the other way
into
around.
my work. And that for me was a big turning point. That's when you can pull everything together and you can apply it and make an opportunity. So that's why I say it's key to understanding. That's how we address stigma, one conversation at a time, and making sure people understand, giving them the right education. You know, let me tell you about this.
Can we do it in schools? Can we talk about this with young people in schools? Because I understand that one of the groups that is where there's an increase is youngsters as young as 13 years old.
That's correct, you know, and we're not testing enough of our youth as well when we think about the percentage of the infections that they, diagnosis that they comprise, and we're only testing, let's say, 28%. But yes, we have an entire division of adolescent and school health that actually does that type of work within schools and getting information out. So yes, and you know, as a mom of 2 adult sons, I always think about when they ask the very first question from something someone said on a bus or something, I gave them information, age appropriate, but the issue there was they felt comfortable coming to mom to ask those types of questions. So we can start it even at that level before they get to school, you know, in your own place, in your own home, but it is important.
Okay, and I'd like to know what it is that the regions of the country where there is less of an incidence of HIV/AIDS, are they doing something better than we are, or is there something we can learn from them here in the South and the Southeast?
I think, you know, we talked about some of the factors that place the South more at risk, sort of lagging behind in some of the treatment and care issues. And then there are more people living with it in some of the areas. And so, you know, there are more, if you have more people living with it, then the risk is higher, even with less risky behavior. So I think, you know, there are certainly getting the prevention messages out, getting the tools out, which is what we're trying to do as well. And the funding going to the places where the work can be done. So.
What a wonderful opportunity this has been for us. Dr. Hubbard, Dr. McCree, Hubbard McCree, thank you so very much for being with us. And please do come back again so that we can continue to have this conversation.
Well, thank you so much for having me.
Okay, it has been such a pleasure.
Pleasure, all mine. Thank you.
There is a wealth of information and statistics on the CDC's website, the Georgia Department of Public Health website, and of course on the Fulton County website. I'll be back with details about Fulton's HIV/AIDS task force in a moment. Back in a moment. Welcome back. What a wonderful conversation we've been having. You know, the Fulton County Task Force on HIV/AIDS held its first meeting in 2015, and since then has been creating and monitoring the implementation of a strategy to end AIDS in Fulton County. The task force also provides advice to the Board of Commissioners regarding issues impacting HIV/AIDS in the county. Now, the work of the task force is available for the public. Its progress report and its presentations are posted on the county's website. And Fulton health professionals, like many across the country, stress the importance of getting tested so that everyone knows his or her HIV status. According to the Centers for Disease Control and Prevention, of the 1 million people living with AIDS in the country, about 15% did not know that they were infected. That's about 1 in 7 persons. Now, Fulton has services for people to get tested every weekday and at special events on the weekends. And that's all of our time. We'd like to thank Dr. Donna Hubbard McCree for joining us today, and we'd like to thank you, as always, for watching. I'm Lynn Vaughn. We'll see you next time right here on Healthline.